Hi, my name is Dr. Ahmadi. I've been practicing dentistry for the past 27 years. In the past 3 days, few of my patients been asking me about the bad breath. I thought it's not a bad idea to go over it briefly. Bad breath, halitosis, or morning breath, these are all the same term that they use for offensive, unpleasant odor that is bothersome to the people around us. I had a patient who came to me and in the absence of her husband said, please doctor, do something. She couldn't even sit in the same car with her husband. So bad breath has to do with the bacterial byproduct or the food we eat. If we want to categorize it, we can say bad breath can be due to the problem inside the mouth, where we have areas where food stays there, and bacteria attacks the food and they produce the bacterial byproducts would cause bad breath. Or if we have gum disease, gingivitis can cause a bad breath because bacteria again can sit in those pockets and cause bad breath. Periodontitis, which is advanced gingivitis, that is inflammation and disease of the bones surrounding the teeth, that could also cause bad breath. Outside the mouth, the food that we eat can also cause bad breath. For example, garlic. Garlic is one of those that exhales through the lungs. So if we use garlic, and when we are talking with the patient in front of us, they would smell because it is exhaled through the lung. And also other lung disease can also cause bad breath. Sinus infection can cause bad breath. The sphincter or the valve that is between the esophagus and the stomach, if it's loose, the bacterial byproduct, the gas that is produced inside the stomach, would come out of the stomach into the esophageal canal, and then it comes out through the mouth, and that would cause also that unpleasant odor. So each one of those has different diagnosis, different treatment. My recommendation is for you to first consult your dentist, and if you have a healthy teeth and gum, then consult your general doctor. Your medical doctor is the one who can direct you to the right diagnosis and treatment. And in the mouth also, if you have a dry mouth, that could also cause a bad breath. Sometimes there is no gum disease, there is no bone disease, there is no dry mouth, there is no lung disease, and there is no stomach esophageal problem, and there is no sinus infection, but the still patient has bad breath. That is due to the bacteria that are there. I've had patient who says they don't have a bad breath and they don't brush. And I have somebody who says he or she brushes 2-3 times and still they have bad breath. So this has to do with the kind of bacteria that we have in the mouth. Therefore, as a temporary measure, I recommend the use of chlorhexidine, 0.12%. Very effective. Just use it a couple times a day and your bad breath will go away. But the downside of this is that it causes your teeth to stain, and it stains the teeth yellowish. So as a temporary measure, if you have an important meeting and you don't know what to do, use chlorhexidine, 0.12%, a couple times a day. With the first rinsing, like for 1 or 2 minutes of your mouth, the bad breath would go away for hours. Even they say if you are in a vacation and you are not in a place when you have access to water and a toothbrush and toothpaste, just rinse this. It would keep your mouth healthy for at least a couple of days. I hope you found this presentation useful, and thank you. Have a nice day.